Well, I like the way you worded that question, Leah, because there really are three different things. Community is a very open and vulnerable space. Okay, if take Instagram for example, you're sharing your inner self, your outer self, with the universe without really any filters, and as a result, there's a vulnerability to that, even a risk um, with things like organizations that call chronic patients out for falsehoods or you know bullying, all types of ableism. So that's one kind of community. But there's a slightly safer community in collaborative support where a person can join a guarded community, say like a Facebook group that you can't get in without getting past the guardians at the door, or things like Healthline apps or Inspire. Um, all these gate kept communities are a bit safer, and so they tend to lend themselves to a little bit more open expression. Um, and of course, there's even more private spaces that groups of patients or family members can create together where they can really express themselves without filter. And all of these play a role in a patient's ability to connect themselves with the world around them, which is really important because chronic illness can be so isolating. And so community becomes extremely important in whatever form it takes. Hmm. That's a tough question, man. Let me do my best here. First, I should say that I come with some background in clinical research myself, um, with building protocols, recruiting for them, and so forth, clinical trials and the like. And first, I want to say perhaps the least popular response, which is scientific rigor plays a big part in this. When investigators develop a protocol to test a drug or treatment or diagnostic tool, they have to have controls. Um, Variables are the enemy of science. They're perfectly reasonable and real, of course, but when you're trying to make a determination about the effectiveness and safety of a specific drug, the last thing you want are a bunch of unknowable elements that can skew your results. So, from a very practical perspective, it takes a lot of extra work to allow for all these variables. And many of the most frustrating chronic illness communities are ones that are poorly understood. Now, of course, the catch 22 here is if they're poorly understood, well, don't we have to research them more? And we can't research them more because they're poorly understood. Well, that's definitely a hurdle we have to figure out how to get around. And I think that's a role that nonprofits can play. And I think, for instance, that researchers who are doing clinical trials should always partner with patient support organizations so that they can also do the wellness and lifestyle understanding of their cohorts that traditional clinical research has overlooked. But as far as ableism, well, yeah. Ableism, sexism, racism, these are all real problems and they cannot be underestimated. But these are often issues that are easy for researchers to fall back on, I think in part because they think that understanding these others who are not themselves would take so much more work. And this might actually limit their access to funding, their ability to get published. It's hard. but yeah, we know it's hard. Do the hard thing. Um, and it's worthwhile. So there's a lot to overcome in research. And I think researchers need to look more holistically at the populations that are being researched. It's very easy, of course, if you're doing a sickle cell disease study, to look um, at Black people because it's more common in their community. But it also exists in other races. So we have to be prepared to open those doors to let more people in, and don't be afraid of these differences. Embrace them, because that's where discovery happens. And so that's my challenge to all researchers listening to this podcast. Don't be afraid of the unknown. Embrace it, because that's where your best papers are going to come from.